Okay, so let's just cover the drugs that are used in various bone disorders. So it will give you a broad overview in order to manage all these diseases of the bone. So the drugs of the bone disorders, the first of all, the first line drug is the bisphosphonate, and you will see that these drugs end with the suffix of dronate. You will see alendronate, pamidronate, and drugs like this. So the bisphosphonate. So what does these bisphosphonate do? The bisphosphonate actually attaches to the osteoclast, and it prevents them in it. It inhibits the osteoclast functions in various different ways. The one which I have just told you, that it binds to the osteoclast and it inhibits them to uh, go to the bone surface and then resolve the bone. The second thing is that it does that it attaches to the hydroxyapatite crystals and thus prevent them from binding with the osteoclast. The next thing they do is that they prevent the osteoclast progenitor to differentiate, and then of course in this way they inhibits their function. And the next thing is they also cause the apoptosis of the osteoclast progenitor cell. So all these various effects is that they inhibit the osteoclast functions. They are the first line drugs for the Paget's disease, acute hypercalcemia, and hypercalcemia of malignancy. So in the hypercalcemia of the malignancy, you know that the most of the malignancies present with the hypercalcemia. Now whenever there is an acute hypercalcemia, so the drug of choice, the first line of drug that you should be giving is bisphosphonate. Similarly in the Paget disease, as we have covered in the previous video, so the Paget's disease, acute hypercalcemia, and hypercalcemia of the malignancy, the bisphosphonates are the first line drugs. They can cause upper GI distress and jaw necrosis. So these are its main side effects which you should keep in mind, and you should address the patient to stay erect in the erect posture for about 30 minutes, so that all the bisphosphonate has traveled down into the stomach and it does not cause the GI distress, such as it may cause esophagitis or it may cause acid reflux, the upper GI distress. So these are its main side effects. So bisphosphonates, the first line drugs in the Paget disease, acute hypercalcemia, and hypercalcemia of malignancy. The next thing that we have is estrogen. We all know that estrogen is given in the postmenopausal, for the postmenopausal osteoporosis. So what does estrogen do? The estrogen actually inhibits the differentiation of the osteoclast progenitor. So in this way they prevents the osteoporosis. So first line drugs was bisphosphonate, but estrogen is used in the postmenopausal osteoporosis. But one thing that is the side effect of the estrogen is that it act on the its receptor on the breast and uterine tissue as well, and it is carcinogenic. So that's why the more reliable drug is the selective estrogen receptor modulator, which is which comes with the name of the reloxifene. The drug that we have is the reloxifene. So these drugs are called as selective estrogen receptor modulator. What these drugs do, that they are estrogen agonist at the bone, so they do exactly the same function at the bone as the estrogen do, that they inhibit the differentiation of the osteoclast progenitor cell at the bone, but they are antagonists at the breast and uterine tissue. So these don't have the side effect of the carcinoma of the breast and uterine and the uterus. So it is a bit more useful than the estrogen because it does not have the side effect. So mechanism of action is same as the estrogen, which we have discussed, that it inhibits the differentiation of the osteoclast progenitors. Now the next drug that we have, that is calcitonin. The calcitonin that we have, it inhibits the osteoclast activity and increase the calcium excretion by the kidney. We know that the calcitonin actually turns down the calcium level in the serum. So what happened, that it inhibits the osteoclast activity so that the bone resorption is decreased, and the other thing that it does, that it increases the calcium excretion by the kidney, so that the increased calcium level that is in the body, that is brought down to the normal level. So It inhibits the osteoclast activity as well as increases the excretion by the kidney, and thus it tunes down the calcium level in the serum. It is of some use in osteoporosis. It is used in osteoporosis, and moreover it has the same use as the bisphosphonate, but the bisphosphonates are the first line drugs. But so the it can be used where the bisphosphonates are used, such as we have studied it that bisphosphonates are used in the Paget disease as well as in the Paget disease. And along with that, here I can show you. So Paget disease, acute hypercalcemia and hypercalcemia of the malignancy. So in the same way, in the treatment of hypercalcemia and Paget disease, you can use the calcitonin as well, but the first line drug is the bisphosphonate. And one side effect that it has, that it can cause hypocalcemia since it tunes down calcium, so hypocalcemia may ensue. Now the next thing that we have is parathyroid hormone. Now the parathyroid hormone, it act on the parathyroid hormone has a bit of the physiology, that the parathyroid hormone, what it does, that it actually act on the osteoblast, and when it act on the osteoblast, it expresses, the osteoblast expresses the rankle, the ligand, which is called as receptive activator of the nuclear factor kappa B ligand. So this ligand is expressed on the blast cell, and this ligand is then identified by the receptors, the rank receptor on the osteoclasts, and once these osteoclasts are activated, so they then cause bone resorption. So the parathyroid hormone, you must know this physiology, and once you know this physiology, you will know the drug that can be used, that is the monoclonal antibody against rancor. So we have derisumab. So this is the drug, that what these drugs do, that this drug actually, it is against the rankle ligand. So once it is against this, so what will happen, that this whole series will stop. Once you stop this or antagonize this ligand, so the class won't be activated, and that's why it can be used in osteoporosis, because the class function will decrease and bone resorption will decrease with the help of this monoclonal antibody. Thank you, that will be all for it. If you haven't subscribed my channel, do subscribe, and I will be putting all these notes into my Facebook group, and I will give that link in the description below. Oh, thank you.